Welcome to MedNuggets Podcast, the podcast that explores important topics in healthcare and wellness. Today, we're diving into a crucial subject, the complications of diabetes. Let's start by discussing the basics. So, Malisha, could you briefly explain what diabetes is and how it affects the body?
Yeah, of course. So, diabetes is a chronic condition that occurs when the body either doesn't produce enough insulin or can't effectively use the insulin that it produces, right? So, insulin is this hormone that regulates blood sugar levels in your body. So, when sugar in the blood can't enter cells to be used as energy, it starts accumulating in the blood, causing high blood sugar levels in the bloodstream. Right, and over time, consistently high blood sugar levels can damage various organs and even systems in your body, and can lead to complications, and can lead to acute and chronic complications. Right.
Yeah, that's a great overview, Malisha. Let's start with the acute complications. So, acute complications of diabetes can develop rapidly and require immediate medical attention. The two most common acute complications are diabetic ketoacidosis and hyperglycemic hyposmolar state. So, diabetic ketoacidosis typically occurs in people with type 1 diabetes, and it results from a severe shortage of insulin. So, when you do not have enough insulin, the body starts breaking down fat for energy, which produces ketones as a byproduct. And this rapid buildup of ketones in the blood can lead to a life threatening condition. Hyperglycemic hyposmolar state, on the other hand, is more common in people with type 2 diabetes. This is characterized by extremely high blood sugar levels and severe dehydration. Hyperglycemic hyposmolar state can also be life-threatening and requires immediate medical intervention. The long-term complications of diabetes can happen when high blood sugar levels damage your blood vessels and nerves. So some of the complications are it can affect your heart. Diabetes, it significantly increases the risk of heart diseases like coronary heart disease, heart attack, and stroke. And also a condition called peripheral artery disease. That is, diabetes can cause narrowing or blockage of blood vessels, usually in the legs, leading to poor circulation, wounds that don't heal, and increased risk of infections and amputations.
And the elevated blood sugar levels that take place in diabetes can even damage the blood vessels in your eyes, in the light sensitive tissue at the back of the eye called the retina. And this condition is known as diabetic retinopathy.
Yeah.
Right, so too much sugar in your blood can block tiny blood vessels that nourish the retina and cut off its blood supply. And in response to this, the eye sort of attempts to grow new blood vessels. But the problem with these new blood vessels is that they don't develop properly and can leak easily, leading to vision problems and even blindness if you don't treat it, right?
Yeah.
And not only that, diabetes can even damage nerves in your body, a condition that we call diabetic neuropathy. And so this diabetic neuropathy is another very common complication of diabetes that affects around 50% of people with diabetes. And this happens when high blood sugar levels damage your nerves. The symptoms of diabetic neuropathy actually depends on the nerves it affects. For instance, if it damages the nerves in your hands and feet, it can produce symptoms like numbness, tingling, a burning feeling, and an extreme sensitivity to touch. So for these patients, sometimes even the weight of the bedsheet can be very painful. Extremely dangerous complication of diabetic neuropathy is foot ulcers or wounds that don't heal. These wounds and ulcers, they commonly happen in the feet because your feet are like the dirtiest part in your body, right?
Yeah.
And the reason why a lot of people develop these wounds is because when you have neuropathy, this neuropathy can damage the nerves that carry pain. So with time, you won't feel pain even if you cut or hurt your feet. So a wound may easily go unnoticed, right? And because diabetes can also damage tiny blood vessels, it will be harder for blood to get to the area of the wound to help in the wound healing process and to fight off infections. And as a result of that, your wounds will take a very long time to heal or may not heal at all. And germs like bacteria that get into the wound can keep multiplying and may even get into the blood, a condition that we call sepsis in medicine. And sepsis can even cause death, right? So if you are having diabetes, you must check your feet every day. look for things like cuts, for redness, and check the skin and even toenails for things like warts or spots that your shoes could rub on. And also make sure make sure to check the bottoms of your feet too, right? Thoroughly.
Yeah, they say, right, when you have diabetes, you need to take care of your feet like you take care of your eye.
Yeah. And not only that, diabetes can also damage your kidneys and impair its ability to filter waste from the blood. And this can eventually lead to kidney failure, right?
Yeah, at least 1 in 5 people with diabetes, they will need treatment for diabetic nephropathy at some point in their life.
Yeah.
So, while diabetes-related complications can be daunting, there are steps individuals can take to prevent these complications. It is important to maintain a healthy lifestyle. This does not mean you stop everything and anything sugary, stop eating everything and anything sugary.
Yeah.
You should also enjoy life, but have these in moderation and make sure to get some kind of exercise every day for at least 30 minutes.
Yeah.
And developing these habits from a young age can help delay the onset of diabetes and therefore prevent or delay its complications.
Yeah, and if you do have diabetes, make sure to follow your doctor's advice in terms of taking medications and lifestyle changes, right? And also attend regular checkups with your doctor and follow their recommended screening tests so that this will help to catch any complications at an earlier stage in your disease.
Yeah, and also like Malisha explained, make sure you check your feet for wounds every night and don't walk around without slippers. It's best to use diabetic shoes if your sugar levels are high. And other than this, maintain a healthy blood pressure and cholesterol levels and quit smoking, because smoking can significantly worsen the complications that is associated with diabetes.
Yeah, so before we wrap up, we want to emphasize that by actively managing diabetes, you can greatly reduce the risk of developing complications of diabetes. Regular communication with healthcare providers, education about the condition, and support from family and even friends are all important components when it comes to managing diabetes successfully, right?
Yeah. So with that, we end our episode on diabetes. Thank you for tuning in to this episode of Med Nuggets podcast. Remember, your health matters, so take charge of your well-being. Until next time.